Okay, I have a corneal disease called Fuchs dystrophy, and basically it's a disorder that causes the cornea to swell. My vision became foggy and almost filmy. Bright lights or headlights could cause blindness, and it could be painful. I could not see to drive at night and have not done so for years. And basically it's just a feeling of strain or tiredness most of the time. This disease did change my lifestyle. I haven't driven at night for about 15 years. I don't read as much because of the strain. I don't sew hardly at all because I don't do a very good job because I can't see. But basically the loss of vision is so gradual that you don't realize what you're missing. I learned that a cornea transplant might be an option for me more or less over time. I was diagnosed with Fuchs dystrophy about 20 years ago, and because of family history, it runs on both sides of my family, I expected it sooner or later. Although there are different degrees of Fuchs dystrophy, mine is more extreme than others, and it came at an earlier age than I had expected. But it's been in the back of my mind for quite a few years. 15 years ago, it was transplanting the full cornea, which was a very long recovery process. And things have advanced so fast and so well, lucky for me, that at this point in time, the transplant is only one layer, and it's the 5th endothelial layer of the cornea. So instead of having the full cornea transplant, they just take one layer and replace it with a transplant. The procedure was not difficult for me. It may have been for Dr. Isbey and the team, but for me, it was actually almost fun. The cornea transplant has changed my everyday life on in a broad way. Colors are more vivid, lines are sharper, things are more defined. I can see detail now that I couldn't see before. I anticipate being able to sew again, read well again in a normal print, and perhaps paint again. The downside to the surgery was the first time I looked in the mirror and could see myself, I looked 10 years older. And most everybody I know looks 10 years older. But I anticipate with the second surgery that, that I will hopefully not wear glasses full time, which would be a pleasure to me. And that I'll be able to do things normally and do things well again because I can see.